Welcome, everybody, to Dr. Smith Live, our 78th episode, and it's going to be a good one. Just a little housekeeping before we start in. Tonight will be our last show for the season, and we'll be back on September 15th. A well-deserved vacation I need, basically. And the key in the equation is that our country and our world is basically in a downward spiral. We got fake news, fake politics, fake money, and fake medicine. And tonight we're going to shed some light on some really effective, relatively non-invasive ways of healing the body. So anyway, I have a really good friend, Stuart Kauffman. He's a DO, and he's put together some really fantastic technology on regenerative medicine. I believe this is another new frontier in the healing process that traditional medicine doesn't even know that they don't know. And anyway, we're trying to enlighten the public so that they can make a better informed decision. So we're going to be talking about incredible regenerative effects of stem cells tonight, advantages of using growth factor with stem cell treatment, best ways to treat sports injuries without drugs, effective treatments for arthritis, tennis elbow, tendonitis, and other musculoskeletal injuries, and the use of ultrasound as a precise way of determining joint and soft tissue injuries. So anyway, Dr. Kauffman, welcome to Dr. Smith Live. Thank you for taking time out of your busy schedule to share your incredible knowledge. I mean, you just, there's an old saying, beware of young surgeons and old barbers. So Dr. Kauffman has over 1,500 hours of experience working with these surgical procedures, non-invasive things. And the name of the game is he's not the new guy on the block. So Stuart, welcome, and thank you so much. Could you just tell our audience, especially with the stem cell, I know there's a lot of people that are getting stem cell injections from goats from Indonesia or something, or Mexico or some, but this way you're using the patient's own stem cells. Enlighten us.
Well, first of all, I'd like to thank you for having me. This is an honor and a pleasure. And so everything that I do as far as regenerative medicine is autologous, meaning coming from the patient's own body. So I do not use placental stem cells or stem cells or growth factors from other patients or donors, which is much safer because you don't have to worry about transfusion reactions or allergic reactions, and especially infection. Dr. Smith will tell you, they check, these placental stem cells for, a couple hundred different bacterium, viruses, and other things. But there are so many pathogens out there that we haven't even identified. So even though it's safe basically for things like HIV and hepatitis, there are other viruses and bacterium and other pathogens that we haven't identified that there's a chance if you use those placental stem cells, which a lot of clinics do, because they don't have the skills to harvest the patient's own stem cells. And so I do autologous stem cells. We either do a micro lipoaspiration. Micronized fat is loaded with stem cells, and we get that fat from just above the gluteal area, above the buttock area, and with an incision the size of a pencil head, and we put some basically just saline and Novocaine or lidocaine, much like with a little bit of epinephrine, much like a dentist would use to numb up a tooth. So it's very safe with saline, just to break up the fat with an instrument, and it's called tumescent fluid. We leave it in there for a little bit, and then we wait about 15 minutes, and then we remove it, and it's liquefied fat, and then we put it in a special device and a centrifuge, which allows me to take the lidocaine and all the other things that may be in there off, and as well as the oily fat that you find in fat, and you're left with just, adipose tissue.
So what kind of situations would that lend itself? Like someone had a herniated disc, for example, or torn ligaments, or what type of situations?
So with the stem cell, we can treat all kinds of musculoskeletal injuries. The spine we can treat. Patients with herniated discs, who have neck and low back pain. We can treat severe osteoarthritis patients that have stage 3 or 4, which is the most severe type of arthritis, osteoarthritis, which is more degenerative. It's not an autoimmune problem like rheumatoid. It's just old age and wear and tear. Some people are more prone to inflammation than others, probably because of their diet and other things. But so we take those stem cells and we mix it with growth factors that we can get from the patient's blood with a simple blood draw, spin it down and remove the white and red blood cells, and we're left with the platelet-rich plasma, which basically is where all the growth factors are, including cytokines, which are messenger cells to allow other cells from the body to migrate to the area to heal. And so we can get great results without having knee replacements. And there are many patients that are referred to me by cardiologists. The patients are too sick to have a hip or knee replacement, and they need to exercise and they need to be active. And so it's a great alternative, especially for those patients. But for me, I don't want heavy metals, put in my body, the prosthetics. And I've seen so many failures over the years, infection. You get an infection in a joint, it eats it away. Or they put the wrong size prosthetic in there and it doesn't work and you're in chronic pain. And if you do get an infection, you need a PICC line, which is a line they have to put through your arm centrally, and you're getting antibiotics which are toxic. And they even have to put a spacer in there where your knee is open and draining all kinds of pus.
Wow.
And, our pediatric dentist, you've probably seen Dr. Bressler, Cavity Busters. Great shape, very successful man. He advertised all over in stadiums and everything, and owned all kinds of surgical centers for pediatrics. Wonderful man. He passed away on the table at Jefferson from a knee replacement. So there's a chance of things going wrong as far as anesthesia as well. And there was no reason for this man to die. Healthy young guy, probably mid 60s. So there's a lot of complications to surgery. Now, I train with physicians down in Fort Myers, and there's a gentleman down there. His name is Dr. Luca Podesta, who did probably over 1,000 professional athletes. And with the stem cell and his protocol, 80% of the patients will get 80 to 90% pain relief for at least 5 years. So, you do another one in 5 years and you can avoid having to have a knee replacement, because I'm seeing patients in their 40s and 50s and they wear out in 10, 15 years. Now you got to have another one. So it's a great way to treat osteoarthritis of any joint. You can use it for any joint. And you can also use it for soft tissue, rotator cuff. Dr. Smith mentioned tennis elbow. You can treat any joint really in the body using your own healing process to
One of the things you
heal.
mentioned to me earlier, that the recuperative period is like, and you're in the express line. It's like really quick. Is that right?
Absolutely. A knee replacement is extremely painful. Most patients, if their physicians aren't scared, they're going to write narcotics because it really is painful. And then they have rehab that they have to do. And it's a long recovery period, where stem cell, you have a couple days where I tell patients to rest, and they're back in the game pretty quickly. And I'm going to tell you that physicians who were trained Western medicine, just like I was, I'm seeing a lot of physicians coming to me for platelet-rich plasma, which is the growth factors we take from the blood, as well as the stem cells to treat their sports injuries. I recently had a gentleman who came in with a sports hernia who's an amateur MME fighter. And there's one guy who does something called a procedure for a sports hernia. It's $20,000. It's not covered by insurance. And they cut you from your sternum, which is your chest bone, all the way down to your pubic bone. And the recovery is up to a year. He's already back to fighting a month later. And we do all these procedures under ultrasound so that we can look at the soft tissue. X-ray, you can't see soft tissue, ligaments, tendons, and rotator cuff muscle. So he had a 2.5 centimeter tear in his rectus muscle, which is a triangular muscle that kind of is the hallmark for the six pack. And I was able to actually locate it with the ultrasound and fill it with growth factors and stem cell. And, it actually regenerates. Stem cells are blank cells. They're mesenchymal stem cells. You're not going to grow a liver or kidney with it, but it can grow cartilage, bone, tendon, muscle, and even hair and skin. So, this is a procedure that has a quick turnaround time. All of the professional teams in the NFL, NBA, NHL, they all have regenerative doctors. Now, I treated John Ritchie, and it's okay, I can speak about it. There's no HIPAA violation because he talks about me on the radio all the time. I treated his shoulder. He played for Al Davis for the Raiders, who basically, if you missed the game for anything, you were replaced. If he had to replace you with a high school player, he would do it, and you didn't get paid back then. And he was shot up with all kinds of corticosteroids, multiple surgeries. I did his shoulder, and he has full range of motion. In fact, he's coming back for his knees. The problem is that here in Philadelphia, on the East Coast, we have huge medical institutions, and there isn't any alternative. We don't have licensing for naturopathic doctors. Out west, they all have regenerative doctors, including every sports team, the Dodgers, the Lakers, all of them from the Midwest on is huge regenerative medicine. I'm one of only a handful of people in the Philadelphia area who are doing it. And it has other applications too. We treat erectile dysfunction with it. We also treat women with urinary stress incontinence. When they call for sneeze, they lose some urine, and it's usually due to multiple births. Their pelvic floor is weak. The muscles around the urethra are weak, which we can inject and strengthen so that they, can, hold their urine. And we're also doing hair restoration, which is amazing. Patients who are, if they're completely bald, it's probably not going to be helpful. In that case, we can use stem cell. But for the most part, the PRP, the platelet-rich plasma, which you get from the blood with the growth factors, we can take people with receding hairlines as well as loss of hair on the crown and inject those growth factors into those areas and regenerate the hair. There are 3 phases of hair loss, and most people go into telophase due to androgenic hair loss. And we can get them into the growth phase, the anagen phase. And what it does is it basically wakes up the hair follicles, attracts other stem cells, natural stem cells from your body, and cytokines, which also bring growth factors to the area. And patients can regenerate hair. And we've had some tremendous results with hair loss.
Yeah. Now, Stuart, is there any contraindications to the use of stem cells?
That's a great question. We have patients who are, at chemotherapy and have lost their hair. I always call the oncologist and discuss the case. And they tell me, if you can give this young woman their hair back, their cancer, their immune system and their whole mental attitude, if you can improve that, I'm all for it. And there's no contraindication for most cancers. If they have, some type of leukemia or some kind of blood cancer, I usually don't do it. Also, there are some doctors who are using it for autoimmune arthritis, like rheumatoid, psoriatic arthritis, ankylosing spondylitis, which is similar to rheumatoid, but it just affects the spine. I don't do it with those patients because we're using their immune system. And so if you're injecting, their immune system into another area, you could possibly, exacerbate or make their condition worse. But those are like 1% of the patients that may come in. Majority of patients have a sports injury. They tore their rotator cuff or tendonitis, which is what the muscles, the tendons hold the muscle to the bone so you can move the joint. Really aren't any of the contraindications. Platelet counts less than 70. Probably isn't a good idea to do it, but for the most part, very few people, are, not able to do the procedure because of contraindications. But we do, as I've been a general medical doctor for 27 years, and so I have a lot of experience in patients with all different types of diseases, and I pretty much know, who is going to be a good candidate and who isn't. And we do, tell patients this isn't the right procedure, like anything else. But
a question here: is it be beneficial for carpal tunnel?
Yeah, carpal tunnel is fantastic. So, just to kind of give you a little idea, carpal tunnel, you have the tendons that allow you to flex your fingers, and it runs through a little tunnel called the carpal tunnel. There's a ligament above, and usually what they do when they treat it is they cut that ligament to open up the tunnel, and then it comes back again because you get inflammation. But there's a nerve called the median nerve that runs through that same tunnel that the tendons run through. So traditionally what we would do is we would inject cortisone into that tunnel. Probably not a great idea, because you're going to weaken those tendons, and you can even snap those tendons if you're going to shoot cortisone in there. And it has other bad side effects. You can get cataracts from, cortisone or prednisone or those types of drugs. It actually weakens the joints and can also cause the tendons to spontaneously, just rupture. Yeah. So the great thing about PRP and stem cell, I can inject right into the tendon, and there is no chance for any tendon rupture. In fact, the PDR, nobody uses it anymore. If it's just in death reference, basically it was contraindicated to take corticosteroids or steroids, and inject it into the Achilles heel because the chances of spontaneous rupture were huge. I can take PRP or stem cell, and I can treat an Achilles tear without having to worry about that. So, yeah.
Have you ever used a systemic enzyme called zymesins for post-operative issues? Because it's double enteric-coated, so the stomach acids won't destroy it. And it's in Europe and Asia, all surgeries, the patients get this, systemic enzyme, which cuts down on pain, also on inflammation. It's miraculous.
I have not had the opportunity, but I believe you and I spoke about it at one point, so I'm aware of it. The other thing post-surgery is patients can get post-surgical stress ulcers. So that sounds like a wonderful natural medication or nutraceutical that could decrease the risk of, having, a stress ulcer, post-surgery, which is always a possibility. So I'll have to look more into that, and certainly it sounds like a great idea.
Yeah. Have you ever piggybacked ozone treatment with the stem cells?
Yes. In fact, I saw a lady with osteomyelitis. We're actually going to use bone marrow, and we're going to mix it with the PRP, and we're also going to do ozone. We'll do probably 10 ozone treatments for a bone infection that wasn't able to be healed with antibiotics, which she was on for months and months and months. And with antibiotics, you're on it for months and months and months. You can get something called C. diff, which is very dangerous, where you lose all the natural flora of the bacteria in your GI tract, and you have the worst diarrhea, and you can end up being dehydrated. You can die from it, and patients end up in the hospital. Or you can get candidiasis of the esophagus, which is basically a yeast infection, or thrush. So antibiotics are useful in certain situations, but if you can avoid using them, even the general medical community has cut down tremendously using antibiotics, because they realize that unless you really absolutely have to use them, don't use them. Most people will come into my clinic. I also did urgent care as well, and they had a bronchitis. First thing that the guy who owned the urgent care would say to me is, give them antibiotics. And I would say, well, 95% of bronchitis is viral. Why would I do that? And it was more of a business model than it was, a medical model.
Right.
So,
have you ever used like frequencies for infections?
I have not. But
very effective.
Over the years, Jerry, you've educated me so much on that, and it's not my expertise. And if I have patients, I send them to you with that.
Yeah, there's so many natural. I mean, I had a patient years ago. He had a real MRSA, methicillin resistant staph, and I was 31st doctor, and I put him on oregano, and in 6 weeks, the MRSA totally disappeared. It's very powerful, oregano.
It's amazing. I mean, MRSA is nasty. Most of us may have been infected, and it actually lays dormant in the rectum and also in the nasal cavity. And so people may not even know they have been infected because they may not have a big pimple or a furuncle or a boil, and it's a dangerous bacterium. And so if you're going to use frequency type medicine, to disrupt the cell membrane or the RNA in the bacterium, it's basically working like an antibiotic without all the horrible effects because the bacterium can't replicate. Yeah. So, it's amazing, that whole concept.
Yeah. The other interesting thing, last week we had Professor PEskin on, and in fact, I just got his supercharged Sunoco racing fuel organic omega-6, omega-3 oils. I just took my first dose tonight, and I can really feel the difference. But he had to have some heart surgery, and he's been taking his own oils. And the cardiologist, the surgeon, said he never saw a patient heal so darn quickly because it opens up the cell membrane, repairs the cell membrane, so you get dramatic improvement, like unbelievable.
So you mentioned to me about omega-3 and omega-6. I mean, I was familiar with both. So I've done some research, and we talk about cholesterol all the time, and everybody's on a statin, which is really toxic because they think that the general medical community thinks that cholesterol is what causes blockages in the arteries. And the reason why the omega-3, 6 that you're talking about is probably so effective, and you're talking about cell membrane, is that the little particles, the lipoprotein, low density lipoprotein particles, and the very low density lipoparticles, they are very small, and they're able to get into the intima, which is the inner part of the wall of the artery, where they can cause blockages. And then if it breaks off or fractures, you get platelet aggregation and complete blockage of that artery, and that's how you have a heart attack. Well, I can tell you that I have patients with cholesterols of 350 or higher, and they never get heart disease. And I have patients with cholesterols of 120, and they've already had a bypass surgery. So what is the reasoning behind this? It's called inflammation.
And money.
We talked about this, Jerry.
It's money. The statin drugs work in 1 out of 100 patients, and that's by luck.
Well, but the thing is that when you're talking about this omega-3, omega-6 combination, if we can eliminate the inflammation of the arterial wall, then your cholesterol really is probably not going to be effective. Without inflammation of the arterial wall, these cholesterol particles don't enter into the artery. So, that's the whole thing is that treating inflammation and omega-3, 6 combination that you're talking about is going to keep those arteries from an inflammatory process that allows the cholesterol to enter. So it's kind of like putting a deadbolt on a door. Okay, you could have Hulk Hogan on the other side; he's not getting in, and that's what omega-3 and omega-6. And I'm extremely interested. We talked about it in the specific product that you were talking to me about, because the statins can cause rhabdomyolysis, where you can have the muscles break down and leak myoglobin, which can destroy your kidneys. You get liver failure from it, myalgias or muscle pain. And they also lower CoQ10.
Yeah, type 2 diabetes also.
Correct. Type 2 diabetes. And that was actually in JAMA, I believe. They wrote an article. So they want all diabetics to be on statins and have their LDLs less than 70. The only way you're going to do that is put them on a statin. And now you're increasing the risk for more problems with their diabetes. So, I would not personally take a statin. Of course, I'm not telling anybody to stop their statin. Of course, you would talk to your physician about it. And like Dr. Smith said, in some patients, it may be appropriate. So personally, though, I think we need to look at them a little closer and look for other natural options, to control, in my opinion, the inflammation, not necessarily the cholesterol, which make up the plaques.
Yeah, the bottom line is it's the omega-6 that's way more important than the omega-3. All the studies, unfortunately, were done with adulterated omega-6, and the doctors think, oh, it's pro-inflammatory. But organic cold-pressed omega-6 is anti-inflammatory, and it'll actually help dissolve the plaque out of your blood vessels. And 85% of the plaque is basically adulterated omega-6 oils in the arteries. That's been proven scientifically.
It's so interesting you talk about omega-6. In medical school, we were taught that omega-3 good, omega-6 really bad. That it was pro-inflammatory.
Total
stay away from the omega-6, but your product that you're talking about is different. And, all of our curriculum in medical school is basically written by the pharmaceutical companies.
Right.
So over 27 years, and I believed everything that I learned in medical school until I got into practice and I saw what I learned. I would say quite a bit of it didn't really work out well for the patients. And so you start to learn what really works and what doesn't work, and you're starting to look for alternatives. Now, fish oil is not a drug, so the drug companies couldn't do anything with the omega-3. So what they did was they came up with a couple different medications that have high levels of omega-3. Excuse me. When they talk on the commercial about the medication, they talk about possible LFTs or liver function testing being elevated and other side effects. And the reason is they made it a drug by adding ethyl esters. Ethyl esters are alcohol.
Right.
Okay. So they turned it into a drug by adding alcohol. That's how creative the pharmaceutical companies are. Very dangerous, actually, in my opinion. Again, consult your physician if you're on these. Please don't stop them based on what I'm saying. But it doesn't make any sense to take something that has alcohol in it to make it a drug so the drug companies can sell it.
Well, what's interesting is that the PEskin has the hardcore documentation. Your skin has 1,000 to 1 ratio of omega-6 to omega-3. Your nervous system has 100 to 1 ratio of 6 to 3. Your organs have about a 4 to 1 or 6 to 1, 6 to 3. Your adipose tissue is 22.5 to 1 of 6 to 3. So how in the world can omega-3 be more important than omega-6? It's impossible.
Well, like I said, they told us omega-6 is basically poison for the body. Omega-3 is not. So,
well, the reason, first of all, the fish oils, according to PEskin, and any patient that comes in that's on fish oil, I tell them you got to get it off it because it's rancid at room temperature, and it creates, it decreases your ATP and the mitochondria in your heart, and it'll cause congestive heart failure. Documented. It's not a maybe.
No, I've actually read that, and he mentioned mitochondria and ATP. Mitochondria, is basically the powerhouse of the cell and inside the cell, and ATP is what you produce to have energy for the cell. And if you destroy those, you're in big trouble.
Absolutely. So it's really exciting that there's not too many practitioners like you around that have the expertise to do this type of stem cells. Am I correct?
Correct. I also do bone marrow. People are freaked out with bone marrow because they think of cancer patients. It's really painful. But all the nerve endings on the bone, it's called the periosteum or the outside of the bone, the cortex. That's where all the nerve endings are. So when we do these, we pepper the periosteum with lidocaine, and so there's really no pain if you let the lidocaine sit in. And we don't use a ton of it. I try to use minimal amounts of lidocaine. Actually, we use procaine. It's probably, I
Safer.
think
Yeah.
Dr. Smith would know, with his experience using these canes, that procaine is definitely safer. So
Yeah.
once you do that, you can take, basically it looks like, I hate to say it looks like an ice pick. Patient doesn't see it because they're prone, they're laying on the table, and you go in a few centimeters or so, and there's a stylet you pull out of it, and then you put a syringe to it and just pull the bone marrow out. Patient just feels a little bit of pressure. That's it. And then we can use the bone marrow, spin it down, and pull the stem cells out. And again, stem cells are blank cells that can differentiate. In this case, with bone marrow, they're mesenchymal, so they can differentiate into bone, ligaments, tendons, muscle, skin. We also do a lot of stuff with the adipose as well, Jared, with cosmetics. Instead of putting Botox and toxic fillers, we could take their own fat and we can use that to fill in fine lines and give them more volume in the cheek area. As you get older, you get some atrophy, and give them a healthier, more vibrant look. We can also treat the dark circles under the eyes, which is just pulling the blood with the PRP. And we can also use microneedling with the PRP, making tiny channels with a special instrument. And what that does is it basically rejuvenates the skin, increases collagen and elastin. It also can take discolorations out of the skin, as well as just giving the skin a fresher look. So
I always,
so many applications.
yeah, I tell patients they should get their navel retied and they can pull all the wrinkles out. Yeah, it's amazing. Do you have a contact number that people can, give you a buzz, or you have a website that they can go to and look for more of this information?
Yes, I would. You can go to PRP in Philadelphia, Dr. Stuart Kauffman, and I have I also have an assistant, Jerry, and his name is Jerry. And so, if you go on the website, the telephone number's on there, and you'll be talking to Jerry. All of our consultations are free. There's no high pressure sales or anything like that. I explain everything and all the other alternatives that they may do, and whether it's right for them. And if they want to do it, it's a surgical center. There's another surgeon there who does his surgery there. And so the facility is great. I rarely use fluoroscopy, which is x-ray, because of the radiation for the patient and myself. However, there are some times where I do need to use an x-ray, such as when I'm working on the spine, or if I need to look at a joint to see what kind of arthritic condition it's in. But most of it's done under ultrasound, which is really safe because it doesn't give off any radiation. And for soft tissue, x-rays don't show soft tissue. They only show osseous or bony anatomy. So, if you're interested, take a look at the website, PRP in Philadelphia. And there's a lot of great information. There's a lot of peer-reviewed articles and other information on what we're doing there. And you can also read some of the testimonials and some of the patients that I've treated. I think it's very informative. And again, I have my own personal assistant that does all of my scheduling, and he is very helpful and very knowledgeable because I taught him pretty much everything about regenerative medicine. No, I'm just kidding. He actually knew a lot about regenerative medicine before I even met him. So it was really terrific to have him.
Yeah. So, Jared, do we have any questions from our audience? How about growing teeth? That's a good one.
Well, Jerry, growing teeth, no. But as you know, PRP actually really found its real, beginnings in dentistry, in periodontal disease, as well as patients with osteoporotic or weak bone, and they actually can inject the PRP, strengthen the bone, and these patients are able to have implants that, wouldn't necessarily be able to. You probably don't like implants, but
I don't, yeah.
it definitely does help with periodontal disease and the inflammation, and it has huge applications, not only in dentistry, but now they're using it in cardiac surgery, where they'll take PRP and they can see the area of where the heart attack occurred. These cells are like in purgatory. Some of them live and some of them die. They're like stunned. They call it stunned myocardium, or stunned muscle from the lack of blood flow. They'll inject it right into those areas, and they're able to save a lot of the myocardial cells or cardiac cells or heart cells by putting the PRP in there. So it's getting more and more popular. We use it for wound care, for non-healing diabetic wounds that just won't heal because no blood flow is going there. And so we basically are tricking the body. We're taking their growth factors and we're concentrating them 10 times, 8 times that what's in whole blood. And we're just injecting it right into the injured area. So of the diabetic wound. And, so they're using it in wound care now.
Yeah.
It's the future of medicine. Unfortunately, the FDA will never approve it for a number of reasons. And I don't want to get into anything. I kind of fear my life when I start talking about, conspiracy things when it comes to medicine. But they're never, because it's not a food, it's not a drug. And, so they're not going to approve it.
Right. Well, it takes
However, there are more peer-reviewed articles and studies from some big institutions like UCLA and places like that have done many, many really long studies that show its efficacy. And I can tell you that Tiger Woods had it done. Hines Ward won the MVP of the Super Bowl after a high ankle injury. Within 3 weeks, he would never even have gotten into the Super Bowl if he would have had surgery or cortisone or whatever. And Jack Nicklaus had his shoulder done with stem cell. And even C. Everett Koop, who our ex, Surgeon General, had regenerative medicine. And nobody had more Western medicine training than he did. He was a pediatric surgeon who separated Siamese. I shouldn't say Siamese. We call them conjoined twins. That's an antiquated term that we really shouldn't be using. But and he actually had regenerative medicine. So it's definitely mainstream, and there's lots of information on my website and other places that you can look on the web that actually have good information. There's some bad information on regenerative medicine, and you have to kind of weed through some bad information versus the good information. That's the problem with the web. You don't know what's real and what's not. But you can call my my office, and Jerry is available pretty much 24/7 to answer your questions, and he can give you the real information and send you good information as far as studies on what we're doing.
Yeah, there was a question about injecting it directly through the cerebral spinal fluid to the brain.
I would not recommend, in an office setting, injecting anything into the cerebral spinal fluid or in the brain. I don't know because I'm not a neurosurgeon, but that would be done by a neurosurgeon. And if a neurosurgeon feels that PRP and stem cell is helpful, I can understand a procedure like that, but that is not something that I would do in my office, or it's just not something that my training would allow me to perform. So I'm not sure why somebody would want to do that. Maybe Chiari malformation.
Well, maybe regeneration of neurons or something like that. But we use infrared device that we put over the ears, and interestingly, the infrared as documentation where it'll stimulate neurons in the brain.
Oh, there's no question. However, again, I'm not a neurosurgeon, and I'm not going to do a craniotomy in
Right.
my office, but certainly I can see all of these applications for every organ system. Again, we talked about cardiac, and we talked about dental, periodontal, and other aspects aside from musculoskeletal and cosmetics. Erectile dysfunction. You have basically, men that have, as they get older, the spongy tissue inside the penis called the corpus spongiosum. It actually gets fibrotic, and so like an old sponge, it doesn't hold fluids. Like an old sponge just doesn't hold water. So we can actually take the PRP. I do a tiny little bit of Novocaine or Procaine into the dorsal nerve of the penis, just a baby dose, and it's a painless procedure. And we inject it laterally so that we're going right into the spongy tissue. And what it does is it helps regenerate that spongy tissue so that when a man does get an erection, they're going to get more size, they're going to get more girth, more sensitivity, because now they have a sponge that can hold the blood. So it's not making the penis grow by injecting. It's just allowing that spongy tissue to hold more fluid. If you hold more fluid, you're going to get more volume inside, and we're getting tremendous results with that. We also do it for women, like I talked about, for pelvic floor dysfunction, and also for sexual dysfunction as well. So again, there's so many applications and so many more, as you talked about, maybe the brain, that in the future, maybe some of these specialists will, decide that it's probably something that they should look into or study more, because there is so much power in the immune system. When I was a young kid in high school, Jerry and I was friends with his son. I always wanted to be a doctor, and Jerry and I would talk about medicine, and he taught me a lot, and I really wanted to do this, but he also was into natural treatments, because he understood the toxicity of a lot of the things that we do in general medicine for anybody. And my point is that we're using the immune system to fix the body. We're kind of helping the body heal itself, by just being a little bit more aggressive and being able to take the immune system and put it in places where it may not be able to get to. Yeah. So when I have colleagues that say, "Oh, it doesn't work," okay, well, what you're doing, putting, drilling a hole in somebody's bone, or, removing bone, to me, that doesn't make any sense. I said, go grab your physiology book and study the inflammatory process and the immune system, and how complement works in the liver, and how, the immune system works to basically run your whole body. And so if it doesn't work, then I guess you can tell the Lord that he created a human body that
it's defective.
Really is defective. So, it's simple. We're just using and how could it not work when it's based on your immune system, which we don't understand everything, but we understand a lot about the immune system, the inflammatory process, and pretty much every disease, including cancer, and I think Dr. Smith would agree with me, is based on, inflammation. And so the inflammatory process of the body, healing and all that with the immune system, so important. And so, and it's natural. The one thing is, it's very safe. You can't have a reaction to it, whether it's allergic, chemical, irritant, or a transfusion reaction, because we're using the patient's own blood or bone marrow or fat, which makes it so safe.
Yeah.
Because anytime you inject something, you don't know if they're going to have a reaction.
That's true. Still, one of the things that I find that's missing by a lot of medical practitioners is hypothyroidism. And when you have chronic infections or you have dysfunction in the immune system, invariably your thyroids are not working properly and the blood tests are not accurate to pick it up.
Correct. First of all, most of the physicians, and practitioners that aren't physicians, they don't even really understand how to read the thyroid function. you have a TSH, thyroid stimulating hormone, which is actually made in the hypothalamus and then in the pituitary, and it stimulates the thyroid to produce hormone. And the active hormone is converted from T4 to T3. You have to look at that whole process. And it's a big problem with a lot of women. It's more common in women than men. And a lot of it is autoimmune, but a lot of it isn't autoimmune. It's just having a sluggish thyroid. And if your thyroid is not functioning correctly, all the cells in your body basically are going to be like, what's the word I'm thinking of? Basically just
sluggish.
Sluggish, yeah.
Absolutely. Well, you know, it's interesting with the so-called autoimmune diseases. In my personal opinion, it's really a crock because medicine can't define what's in the tissue or organ that's allowing the body to attack itself. The body doesn't attack itself in its infinite wisdom. There's something in there. Like my own daughter had, quote, Hashimoto's, and when she told the endocrinologist, my father's going to treat me alternatively, he says it doesn't work. Well, 3 months later, all the blood tests were normal because I diagnosed Epstein-Barr trapped in her thyroid. When I removed it, everything went back to normal.
No, there's no question that a lot of these autoimmune diseases are triggered by viruses or, other infections that we can't identify. But Hashimoto's that's underactive. They're not making enough. Then you have Graves' thyroiditis, which is you're producing too much, and that can cause your heart to race. You can go into a storm. You can and end up in the hospital with tachycardia. And so I agree. I think that the autoimmune process, and they teach us what autoantibodies to look for. But my wife has a thyroid problem, and she doesn't have any autoantibodies.
Right.
So we need to be able to start looking further into what's causing these problems. But the thing is, the pharmaceutical companies have medications. They automatically put you on Synthroid.
Right.
And there are natural thyroid medications that you can use, T4 and T3.
Yeah, they don't like that.
And you probably know which ones I'm talking about.
Yeah.
That you can use. So thyroid is very important. But again, I think hopefully the future of medicine, we're going to start looking at causes instead of just treating disease and figuring out why. I mean, I see so much autoimmune disease in my practice that it boggles my mind. It boggles my mind.
That book, so it's called "Remove the Splinters and Watch the Body Heal." It brings to light the potential splinters that I call, or initiators, that are not being diagnosed by blood tests. I just saw a little autistic kid from down in Alabama came up a couple of weeks ago, and he had like glyphosate in his brain and mercury in his brain and retrovirus in his brain. And blood tests are never going to pick that stuff up.
Of course not. Of course.
So it's fun stuff.
That's the whole thing, is that until we change the curriculum of the medical schools and start looking at other things, and really if we study the body from head to toe, we have physiology, we know how the kidney functions and the heart functions, but basically what they do is they teach us, okay, if you got tachycardia, use this drug. If you have bradycardia, use this drug. If you have atrial fibrillation, use this drug.
Right.
But what we need to really do is we need to figure out, why are people developing these diseases, instead of just labeling it, okay, it's autoimmune. Well, something is causing these autoimmune diseases. And I think we spoke about this. The American diet might be as toxic as smoking cigarettes.
Well, the big thing too,
or drinking.
Yeah, the oils. The majority of oils on the shelves of the supermarkets are adulterated, and they literally turn your cell membrane into plastic. And that's why the oxygen can't get in, the nutrients can't get in, and the waste products can't get out. That's it.
Absolutely.
Yeah. And this new oil, you'll see. You should try it yourself. I just took my first dose tonight. I took a teaspoon. And
well, I want to get my whole family on it, actually.
Yeah. It's unbelievable. So, Jared, do we have any more questions from our listening audience? I believe I had autoimmune issues in the past, but not sure if I still have it. Well, the only test you can really do is energetic testing, because if a heavy metal or a virus or a chemical like glyphosate or so forth is trapped in the organ, it's not going to be in the blood and you'll never pick it up. So it has to be tested energetically to really get an understanding if the what I call the splinters are still trapped in the tissues.
Yeah, and there are varying degrees too with autoimmune diseases. I mean, you could, I guess, if you really wanted to, and again, it's not foolproof because I'm talking about SED rate where they measure the rate of the red blood cells, how they fall, and C-reactive protein, which is also a marker for inflammation. But again, I've seen people with autoimmune diseases with normal C-reactive proteins and SED rates. And, if you have a SED rate that's over 100, you either have cancer, you have an autoimmune disease that's really out of control, or you have something called giant cell arteritis. So you could do those types of tests. But again, unless you really have a really high SED rate or C-reactive protein, you can't rule out autoimmune diseases. So I think what Dr. Smith is saying makes a lot of sense. The problem is we don't have access to it as, general medical doctors.
Right.
So.
Because it's non-invasive and it's amazing. So, there was another question about cartilage there. Can you use ultrasound to see cartilage situation in any part of the body?
Well, cartilage basically is what lines the joints. So when you lose your cartilage, that's arthritis. That's the hallmark of arthritis. With the ultrasound, you can actually, well, X-ray also, you can see cartilage loss, and we grade them, arthritis joint in the joints 1, 2, 3, and 4. 4 being, in the general medical community, you need a knee replacement. 1 being very mild. But yeah, with the ultrasound, you can see a lot of pathology of soft tissue, and you can also use it to look at the joint as well. And we have both in our center. We have fluoroscopy and we also have ultrasound, so that we can take advantage if we do need an X-ray to take a look at it. But all arthritis is cartilage loss, which is what lines the joint. And when you lose that, bone starts rubbing against bone. There's no lubrication, and it's painful. You lose function. And so the answer to that question would be, yes, we use all aspects of, imaging to take a look at the joint. And we can also get an X-ray or, another, possibly an MRI to look at the joint. But I think we're overutilizing those tests. They're expensive. And honestly, you don't really need to do an MRI for every patient with a sports injury. One of my mentors taught me, use your stethoscope, use your brain, and use your hands. Stop ordering all these CT scans with all the radiation that we're doing, with these CT scans, because we can't make any diagnosis today, these young physicians, without ordering a test. Excuse me. The old-time family docs, GPs, internists, they use their stethoscope, their brain, and their hands, and they can make a diagnosis. So without, the radiation is tremendous that we're using with all these CT scans. I think we're creating a lot of problems in patients because we can diagnose these things by just basically examining the patient, doing a good history, and using minimally, toxic imaging, such, to assess it.
The other thing too, I think it's missing from the equation is preparing the body for the healing process with good nutrients like whole body collagen, for example, and quercetin, which is a natural anti-inflammatory, or zymesins, where you're preparing the body for the whole healing process. And that just speeds up, everything and reduces post-operative problems.
No, absolutely. I mean, prophylactic treatment for, injuries is very important. Even rotator cuffs, they're operating on rotator cuffs. I tore 2 rotator cuffs completely and had regenerative medicine. I did my own physical therapy and, running to surgery for a rotator cuff tear is ridiculous,
Right.
especially if you haven't done, something like prophylactically, some of the nutraceuticals that Jerry was talking about, as well as doing some good physical therapy, good diet. And basically, honestly, if most patients would take care of their bodies, eat a good diet, do the exercise, probably they'd put at least half of us out of business.
Right. I agree.
Most of the diseases that I see are self-inflicted,
Yeah.
and we're all guilty of it. I mean, I could do better with my diet. I'm doing better, and I try harder as I'm getting older, but it's hard. The American diet has a lot of, calories, and it also has, terrific taste. And it's basically, due to the things they add, including the oils that you were talking about.
Yeah.
But they're not good for you. That's the problem.
And it's also when you have too many carbohydrates and you raise your insulin level, your inflammation goes way up.
Absolutely. Insulin is pro-inflammatory.
Right.
So, the whole thing, you can do a test. It's a blood test called a C-peptide test, which is basically the peptide that connects the two chains of the insulin molecule. Or you can do an insulin level. When you see really high levels of insulin, that's as bad as any diabetic condition. So they'll have A1Cs. The normal A1C should be like less than 5.7. You'll see A1Cs in the 4.5, and patients think, oh, I'm doing great. My sugar is absolutely incredible. No, you're just making huge doses of insulin and creating a metabolic syndrome, which is pro-inflammatory. It causes inflammation in the arteries, vascular disease, and a whole host of other serious medical conditions. So the like you said, the insulin levels, increasing insulin is probably one of the worst things you can do to your body.
And one thing that people don't realize, if you take stevia, which is all natural sweetener, it still raises your insulin level.
Absolutely. Diet Coke, all of those
Crap. Yeah.
Drinks, all the, not just Diet Coke, but all of the, diet soft drinks, actually will probably make your diabetes worse. You might as well drink a sugary soda, with the additives and the artificial sugars. So, it's
People are killing themselves.
pretty much. I mean, the question that I say is that, in Japan, they have a diet high in fish and in vegetables and rice. And, they're traditionally were big time smokers, and they like to have their sake and other alcohol, and their life expectancy just far exceeded ours. And cancer was almost unknown, until basically we started shipping our food to them, and they ate a more Western American diet. Then you see the same rates of cancer and other serious medical problems.
Yeah. Well, great. I think we gave our audience a lot of information to digest, and your website again is Dr. Stuart or something PRP, is it?
Well, you can put Dr. Stuart Kauffman DO, or P as in Paul, R as in Ralph, P as in Paul, PRP in Philadelphia. And you can go on the website. Again, there's a telephone number there. I do have an assistant that works with me that can discuss your specific case, and we'll be able to answer all your questions and schedule a free consult either by Zoom, or if you need to come in, we would be more than happy to see you in the office. And like I said, we explain the procedure. And again, there's no high pressure sales in my office. If I tell patients this is something that you need to understand and want to do, and if you want to avoid surgery or having to take toxic drugs, with this opioid crisis, why the government wouldn't approve these procedures is beyond my understanding, because we can treat pain and injuries without having to put people on opioids, because post-surgery, everybody's put on an opioid, and it only takes a few days to become addicted. And you don't know who will become addicted and who won't. There's some people who are fine with them. Other people immediately get addicted. So I'm hoping in the future we'll be able to change our thought process on how we treat disease in this country. Stop treating symptoms and disease and treat the person.
Yeah.
And that's pretty much been my philosophy for many years, and I learned it real quick. when I started seeing things that I learned in school, medications I taught that were taught to me, explained to me, and they're just not doing what I was, educated about these things. And so you start looking for other things and say to yourself, well, maybe what I learned probably isn't 100% correct.
Well, thank you so much, Stuart. And just to remind the audience, going to be on hiatus till September 15th. You can go to ghsdoc.live, and we have all our archived interviews there. So there's plenty of information that you can brush up on. ICNR.com has about 181 case studies. You can get all kinds of great information there. There's a lot of articles on ICNR.com. So anyway, thank you again, Stuart. And I think our listening audience is open and receptive, and I think you'll see some people, coming your way because they're tired of getting, beat up on. Honest to God, it's disgusting. So
I really appreciate you having me, and I enjoyed our conversation. And again, PRP in Philadelphia. You can get the telephone number off the website, and you can talk to Jerry, my assistant. And if you'd like to come in for a free consultation, discuss your particular case,
great.
I think that would be terrific. And again, I really appreciate Jerry having me on tonight. And as always, like I said, I've known Jerry for 40 years, and he was teaching me medicine way before I ever finished high school. And he's so far ahead of the curve when it comes to health and medicine and natural cures, nutraceuticals, which again I pray that in the future it can become more mainstream and we look into these things.
Absolutely. So thank you for taking time out of your busy schedule, and thank you, our audience, for tuning in. And if any of your friends ever missed it, they can view it tomorrow on ghsdoc.live. Anyway, enjoy the rest of the summer, have fun, and remember, never trust a doctor who has dying plants in the reception room.
Yeah, or has magazines that are older than 6 months still sitting in there. In the waiting room.